All right, today we're diving into bladder cancer. Now, it's actually one of the most common cancers out there, but here's the thing. A lot of us have no idea what the number one warning sign is. So we're going to follow that entire journey, right from the very first red flag all the way to the incredible breakthroughs that are completely changing how we even think about this disease. Okay, so let's just get right to it. What is the number one warning sign of bladder cancer? I mean, what's that single most important red flag you should be on the lookout for? And here it is, painless blood in your urine. It's pretty staggering, but for about 85% of people who get diagnosed, this is the very first sign. It's the one symptom that really kicks off the entire conversation with a doctor. So yeah, this one symptom, as alarming as it is really where the whole diagnostic journey gets started. Now, the medical term for this is hematuria, but what makes it so tricky and frankly so dangerous is that it can be intermittent. That means it can show up once and then just disappear, maybe for weeks, maybe even for months. And it's so easy to just write it off as a one-time thing. But that can be a massive mistake. And look, the medical guidelines on this are crystal clear. They say that any episode of seeing blood needs to be checked out, even if it only happens once, even if you go get a urine test later and it comes back clean. It still warrants a full, proper evaluation. The takeaway here is just do not ignore it. Okay, so naturally, the next question anyone's going to ask is, why me? Or am I at risk? So let's dig into who is most at risk. When you look at the causes, there's one that stands head and shoulders above the rest: tobacco smoking. It is by far the single biggest preventable cause. And it kind of makes sense when you think about it, right? The nasty chemicals, the carcinogens from the smoke, they get into your bloodstream, your kidneys do their job and filter them out, but then those chemicals end up concentrated in your urine, just sitting there in your bladder for hours in direct contact with the bladder's lining. And this really puts it all into perspective. Smoking accounts for a massive piece of the pie. We're talking 30 to 40% of all cases. Then you've got another 5 to 10% from things like workplace exposures to certain chemicals. But look at that huge slice that's left, the other or unknown. For more than half of all people diagnosed, we actually don't know the exact cause. It just goes to show how complex this disease really is. So, besides smoking, what else are we looking at? Well, bladder cancer is really a disease of aging. The average person is 73 when they're diagnosed. It's also much more common in men. And then there are those occupational risks we mentioned. People who work with chemicals in industries like dyes, rubber, or leather manufacturing. And believe it or not, in some places, even arsenic in the drinking water can play a role. But this brings us to something really interesting and kind of counterintuitive, called the gender paradox. See, men are about 3 times more likely to actually get bladder cancer. But here's the paradox. Women who do get diagnosed often have worse outcomes. They tend to present with more advanced disease and a tougher prognosis. And a big reason for that is that the key symptom, blood in the urine, is often mistaken for something more common, like a UTI. And that can lead to really dangerous delays in getting the right diagnosis. All right, so let's say you've seen a warning sign, you've done the right thing, and you've gone to your doctor. What happens then? Let's walk through the doctor's investigation. Well, there's a pretty standard playbook for this. It all starts with a simple history and physical exam. From there, the doctor's going to bring out the main tools. You've got imaging, like a CT scan, to get a good look at your upper urinary tract, your kidneys. You've got urine tests to look for cancer cells. And then the big one, a cystoscopy, which is basically a bladder scope to look directly inside. And of all those tests, the cystoscopy is really the gold standard. It's the most important test. A doctor, usually a urologist, uses a super thin, flexible camera to see the inside of the bladder in real time. It's literally the only way to know for sure if there are any abnormal growths in there. Now, you might be thinking, hang on, can't I just do a urine test? And that's a great question. There are some new urine tests that look for cancer biomarkers, and the technology is definitely getting better. But right now, they just aren't sensitive or specific enough to take the place of a cystoscopy. Nothing beats actually seeing what's going on inside. Okay, so let's say the investigation does find something. What are we actually talking about when we say bladder cancer? Well, for the vast majority of cases, we're talking about something called urothelial carcinoma. That sounds complicated, but all it really means is that the cancer starts in the urothelial cells. Those are the cells that form the very inner lining of your bladder. And when it comes to figuring out how serious it is, what we call staging, it all boils down to one absolutely critical question. Has the tumor invaded the bladder's deep muscle wall? That one detail, whether it's just on the surface or has gone deeper, changes everything. It dictates the prognosis, the treatment, the whole shebang. And you can see that broken down really simply here. If the cancer is just on that inner lining, it's called non-muscle invasive, but once it grows into that deep muscle layer, it crosses a line, and we call it muscle invasive, and that's a much more serious situation. But there is some really good news here. About 70%, a huge majority of all bladder cancers are found at that earlier non-muscle invasive stage. So for most people, we're catching it before it has a chance to dig deep into the bladder wall. Now, for a really long time, that was basically the whole story. Is it muscle invasive or not? But what we're learning today, thanks to a revolution in genetics, is that bladder cancer isn't just one disease. It's a lot more complicated and a lot more interesting than that. This is a huge shift in how we think. Because of modern genetic research, we now know that bladder cancer isn't really one single thing. It's more like an umbrella term for a bunch of very different diseases that just happen to show up in the same neighborhood, the bladder. They have totally different genetic blueprints. To keep it simple, you can think of them as belonging to two main families, or subtypes. First, you have the luminal subtype. These tend to be the less aggressive, slower growing types. And then you have the basal/squamous subtype. These are often much more aggressive and grow a lot faster from the get-go. So why is this so important? Well, because knowing the molecular subtype helps doctors predict how a tumor is going to act. It can even tell them which treatments, like chemotherapy, are more likely to work. This is the whole idea behind personalized medicine. Not just treating bladder cancer, but treating your specific kinds of bladder cancer. And all of this is pointing toward an amazing future. Right now, scientists are getting really good at analyzing the tiny bits of tumor DNA that get shed into our urine, which leaves us with this incredible question. Are we getting close to a future where a simple urine test won't just tell us if we have cancer, but will give us its entire genetic blueprint, telling us exactly which subtype it is and exactly how to fight it? I mean, that's the future that's being built as we speak.